I I request all of you to be on the camera if you all want to receive the certification. Thank you to Sharp for being on the camera. Rest, please turn on your camera. It is essential. So today our topic for webinar is hypnotherapy. So talking about the webinar facilitator, her name is Mansi. She is psychotherapist with 4 years of work experience in working with diverse range of clients, and she is certified clinical hypnotherapist. So till the time you all can, just introduce yourself. Up to you, Mansi ma'am. You can take the webinar now.
Thanks, Kanika. I'd love to know where what everybody's background is, how many background people are here from psychology, and how many are from some other fields. Both is okay.
Good evening, Mansi. How are you?
Hi, I'm good. How are you?
Yeah, I'm fine. Myself, Tushar Vaid. I'm working in Pfizer as a product manager.
Mm-hmm.
And from my background, I have done Bachelor of Pharmacy from Kurukshetra University.
Right.
And I'm not from the psychological background, but yes, I have taken part in the ICS programs. So right now I'm doing clinical therapies. These type of assignments are going on side by side.
Mm-hmm.
So that's all from my side.
How nice. Thank you for sharing.
Thank you.
So anybody else who is not from psychology background and somebody who is from psychology background, maybe?
Hello, ma'am.
Hi.
I'm Rachel. So I started with MSc Counseling Psychology, but then took a break because some personal issues were there in family. And meanwhile, I finished Child Psychology Practical Program in ICS recently. And I saw this posted today on hypnotherapy, and that interested me. So I'm here today.
Thanks, Rachel. So what about it interested you?
After seeing the poster and also in MSc and in my degree, there used to be this word called as hypnosis, and I just tried searching for it more. So it said hypnotherapy is a heightened therapeutic process where it helps us in concentrating more attention basically, and will help us in solving problems or in reducing the uh, intensity of problems like self-esteem and all of that. So it excited me, so I'm here.
Right. So I'd say whatever you know is accurate. I hope we're able to build some more understanding to it.
Yes,
some more
ma'am.
depth to it.
Ma'am.
So we have one from pharmacy and one from psychology. Anybody else who'd like to share? Okay, so it's okay to, I think somebody wants to introduce themselves. It's okay, you can introduce while I'm speaking also. So I hope that it will be an interactive session, and it's okay to stop me anytime and ask questions or make comments. So you don't need to wait towards the end of the session. If somebody prefers Hindi, let me know so that I speak in Hindi. Otherwise, I'll be switching between both languages. And if anything is not clear, please ask me. So it's okay to pause it, interrupt me, ask questions during the session. Please don't wait until the end of it. So I'll be sharing my screen. So can everybody see it? Can somebody just tell me?
Yes.
All right. So as Rachel shared her idea, her understanding of hypnotherapy, that it is somewhat focusing of attention, which can help to improve concentration, reduce pain. So all of these are some aspects of hypnotherapy. So I'd like to understand more from other people what their understanding of hypnotherapy is, or maybe what drew them to today's session. So we can basically understand that what our general understanding it, maybe add to it or subtract from it a little bit, and then move to a little bit of theory. So what is your understanding of hypnotherapy, if anybody would like to share, and also maybe what drew you to this particular webinar? Anyone?
Like what I understand, Mansi, is that to knowing more better clarity for the client, what's his or her in mind, so that we can give our best to solve the problem of the client. That what I think hypnotherapy is.
So are you saying that it can be used to gain awareness about client?
Yeah.
So that we can facilitate some goals.
Yeah.
So a part of it is true. So for example, if we question in hypnotic state, we might so basically, if a person is in a hypnotic state, we might get some material from the unconscious mind, which might not be readily available if a person is, conscious, awake. So part of it is true. But also this can be done without a hypnotic state also, right? So this is what a lot of traditional therapy looks like. Also, we do not necessarily introduce a person directly to a hypnotic session. A lot of rapport formation is done, case history is done, goals are set already. And those goals are usually utilized to build a session. Does that make sense? So we talk first, then make suggestions, and then take a session, instead of take a session and then figure out what suggestions to give.
Okay, Mansi. Got it. Got your message.
Yeah. Anything else? Anything else comes up? Some myths and misconceptions maybe also. Something you might not think is true, but you have heard about hypnotherapy. Or you're wondering if it is true or not. Anyone?
Hi, ma'am. This is Soumya from this side. Can you hear me?
Yes, I can hear you, Soumya. Hi.
Yeah, ma'am. Basically, I'm a teacher. So I feel hypnotherapy as a stress and anxiety management for the students also. Sometimes even the students require stress and anxiety management in their goals. When they go for exams and all, this anxiety management is most required for them.
Yes. So are you saying that it can be utilized for stress management, anxiety management?
Yes, ma'am.
Yes, you're right. It's definitely true. Anybody else would like to share? Some myths and misconceptions also maybe that you have heard, you'd like to fact check?
So my point of view, it's working on subconscious level. So I don't know about hypnotherapy. That's why I'm here actually. But I got some news now. It's basically it will works on subconscious level.
You're right, sir.
maybe.
Yes, subconscious,
That's
unconscious. You're absolutely right. Okay, so I think all of you have some idea of what hypnotherapy is, and about its use also. So in today's session, what we'll go through is we'll have a basic introduction to hypnotherapy, consider it a 101. And then we'll talk about this guided imagery and visualization, which is essentially one element of hypnotherapy, right? And then we'll quickly discuss what can be benefits of hypnotherapy for professionals and non-professionals. Again, at any point, feel free to ask questions, make comments, and even if you think I'm making some mistake, feel free to point that out, or there is something you'd like to clarify, please feel free to do that. All right. So anybody in psychology or not in psychology either, anybody heard of Sigmund Freud, read his work? So Sigmund Freud talked about levels of mind. Can anybody tell me their understanding of it? Psychology students might be aware of this iceberg
Conscious,
analogy.
conscious, unconscious, and subconscious.
So what is it? Tell me more.
And the conscious mind is that when we are aware of things, what is happening right now around us. And subconscious is that we are partly aware, but again, not fully. And unconscious is we are not at all aware. We don't know that it's happening. It's just happening.
Right. You're right. Anything else you'd like to add?
If I because what we have read is just like a glacier. If we compare it with a glacier, with the glacier, when we see the glacier, we see the upper part.
Yeah.
So the 5% is visible. So the 5% is our conscious part. And the deep down is the unconscious part. And the middle part is the subconscious part. So
subconscious, preconscious.
if we can visualize, subconscious and right.
Yes. Sorry, I'm not able to see you on screen. What's your name?
Ma'am, I'm Shuparna Mukherjee. I'm from Kolkata. And I am doing my master's right now from IGNU. And I have taken clinical psychology, and I have completed my postgraduate diploma in counseling psychology from Vidyasagar University. So I have read there about Sigmund Freud and the ego, superego, and all his works and what he has done, his contribution. And actually, like hypnotherapy is his work. He has started this practice, and how he used to.
Oh, Freud actually rejected hypnotherapy as a concept initially.
But again, he has practiced that on his patients, isn't it? Hypnotherapy.
I'm not sure actually. Maybe something
because
to me to think about.
Yeah, I mean, what I think I may be wrong. You are the person who is taking the class, you know better. But again, what I had an impression is that he used to cure people, like there were some patients, lady patients, and he was given hypnosis, and then she kind of got cured, something like that. I mean, not fully, but that's a part of it which I know.
Oh, maybe I can also look into that. Not necessarily that I'll know everything. What I know is it was free association and unconscious exploring. I know that Freud initially rejected the idea of hypnosis, but there is a psychoanalytic thought in hypnosis as well. So it's possible that maybe he did utilize it. So something, I'm unsure, but I'll definitely look into it. Whatever else you said, Shopana, you're absolutely right. So so it's almost like an iceberg. Freud gave this analogy of an iceberg. So if our conscious mind, the mind that we are aware of, is just kind of like a tip of the iceberg, right? So it is our general state of awareness where information is present at all times. So for example, if somebody asks you, where are you right now? You can say, oh, I am in class with Mansi. So it will require little to no effort from your end. So whatever information is readily available in this moment of time and in this moment of alertness, it's consciousness. So we think, so common sense would entail that, oh, this is what most of our mind is. But actually, it's like just the tip of the iceberg, right? And there are depths of, there is actually more layers and more depth to the mind. So other two layers are pre-conscious and unconscious. Pre-conscious or subconscious, as Shoparna is saying. So pre-conscious is almost like a peripheral state of awareness, right? So you can recall information, but you will require somewhat an effort to recall it. For example, if I ask you, what did you have for dinner last night? You might take some time to recall that. If I ask you, oh, which country is in the extreme south direction, maybe it will take some time to recall it, you know. So it is available, it is accessible, but some kind of effort is required, pre-conscious, just outside the awareness. So if I redirect my attention there, it will become available, right? And then there is unconscious. So unconscious is our deepest level of awareness. So all the information that we forget, all the information that might not be socially desirable, it's not socially appropriate to think. So we might push it to our unconsciousness. And all the unbearable information, a lot of stress, a lot of trauma, a lot of, again, socially undesirable information, we push into our unconsciousness. Our unconsciousness is actually what makes the largest part of our mind. And again, Freud's conceptualization is nothing is forgotten, right? And anything that is not available is pushed into the unconsciousness, including things that we are not able to process, that are socially undesirable. And because we fear rejection, or we fear being alienated from society, we just push it to the unconscious, because all of us want to be socially, morally good people. Does that make sense? Any questions here? Or any comments? Okay. Assuming there are no questions. So why it is important in context of hypnotherapy? So usually the traditional talk therapies are there. They work with the conscious mind, right? So there is a lot of talking involved. In the conscious mind, there is also a lot of resistance. So somebody might not be willing to accept your suggestions. Somebody might feel resistant to accept your suggestions. So there are a lot of blocks that might come. And again, part of other therapy work is to identify these blocks, remove these blocks, work with these blocks, right? But what happens in our pre-conscious and unconscious is, because it is, so they are more readily, they accept suggestions more readily, right? So it's easier for them to accept a suggestion than a conscious mind. So they have less resistance, essentially. So that is why in hypnotherapy, we work with pre-conscious and unconscious mind, bypassing the conscious mind. Does that make sense? Maybe a show of hands, if it makes sense for everybody.
Can you give an
Yes,
example, ma'am, of this?
Example for what exactly?
Just the explanation would have been much easier if we can, associate with an example or current state of.
Okay. So let's say a person, because of their childhood experiences, they have this belief that I am not worthy, right? And that might be too painful for them to tolerate, right? So it is possible that that information has been pushed to unconscious mind because it's unbearable, right? Now, when we are working in talk therapy, let's say CBT, REBT, psychoanalysis also for that matter, we are kind of working with the consciousness. Somebody might say that I feel unlovable, unworthy, without really knowing why. Or if you say to that person, no, you are worthy, they might not be able to accept your suggestion because they're experiencing resistance. They are feeling that it is perhaps not true. So in hypnosis, we are basically working with pre-conscious mind and unconscious mind. When we talk about hypnosis, it will become slightly more clear. So basically, conscious mind is resistant mind. Conscious mind is logical mind, right? So it follows the rules of logic, whereas unconscious is a more creative mind. So, so if we are able to give suggestion to the unconscious, it will be more effective than giving it to a conscious mind. Does that make sense?
Yeah, got it.
Right. So keeping this Freud's theory of mind, we'll talk about what hypnosis is. So as Rachel was saying, Rachel had a good understanding of it. So hypnosis, a definition of hypnosis is an altered state of consciousness where subjects are more receptive to varying degrees to suggestions to act, feel, and think or behave differently than an ordinary waking state. So it is an altered state of consciousness. Right now also you are conscious, right? So consciousness has two features, kind of, time and alertness. So in this moment of time, you are alert, right? So you're conscious right now also. Now in hypnosis, this, you will be alert, you will be present, but it will qualitatively differ. So quality of it would different. So experience of it will be different from what your experience of consciousness is right now. For example, जब आप लोग म्यूजिक में engrossed हैं या किसी बुक में engrossed हैं या फिर आप लेक्चर को सुन रहे हैं और आपको बहुत इंटरेस्टिंग लग रहा है and you are in the state of flow, right? So that state of flow is also a difference in consciousness, right? Is it making sense?
Yes, ma'am.
So in hypnosis also, you are present, you are alert, but that attention is focused inwards, right? We can do a short demo also so that maybe you can have experience of it. So that you are present, but that attention is focused inwards. A good example of it can be if any of you have tried meditating, right? In meditation, you're present, you're alert, but attention is focused inwards. It's a different state of consciousness. Somewhat similar in hypnosis, it is an altered state of consciousness. And because it gives us access to unconscious mind or subconscious mind, we are more readily able to accept a suggestion, जिसे हमें शायद conscious mind से अगर हम सुने तो बहुत time लगेगा उसे accept करने में. Does that make sense? Does that make sense कि altered state of consciousness वैसे भी होता है without hypnosis? जब जैसे हम बुक पढ़ रहे हैं, मूवी देख रहे हैं, जब आप इमेजिन कीजिए जब आप you are alert, you're awake and you're going to sleep. That transition is also an alteration in consciousness. जब आप सो रहे हैं और आप सो के उठते हैं, that is also an alteration in consciousness. So this time and this alertness does keep varying, right? When you're meditating also, you're present, you're alert, your consciousness, but it's qualitatively different, right? So these alterations keep happening. It's a natural phenomena. In hypnosis, what we do is we utilize it to make certain therapeutic suggestions. Is everyone with me? Any questions, any comments?
No, ma'am, so far good.
All right. So some features of so how would you know that if a person is in a hypnotic trance? So some features are, so highly focused concentration, diminished peripheral awareness and heightened suggestibility. अगर किसी ने भी guided meditation किया है, they will have somewhat of an understanding of what all of this is, right? कि आपका concentration high है. If it's guided meditation, they are also giving you some suggestions, like you're feeling more calm, you're feeling more peaceful, you're more readily able to accept those suggestions. And क्योंकि you're focusing inwards, there is less awareness of surrounding around you. That doesn't mean you will not be able to attend it, right? So अगर आपका attention जैसे आप रूम में बैठे हैं, आपके पास कोई आपका फोन बजा meditation की state में, so you'll be able to hear it, right? Your attention will shift. That's what we were talking in pre-conscious mind also, that we are able to retrieve information but with some effort. So we have a peripheral awareness. It is diminished, but it's there. Our attention is focused inwards, and our suggestibility to accept suggestion is more. So if somebody is saying to me in a meditation that you are feeling more calm, you are feeling more at peace, I'm more likely to accept that rather than when I'm fully alert, fully awake, and somebody says, okay, calm down. Right?
So that means like all the external factors during the hypnosis is, I mean, the external factors does not have much does not have much thing to do on that person who is getting hypnotized. Is that so? I mean, the influence of the external factors gets reduced.
You can say that in a way. Just to add to that, hypnosis also, matlab, जब आप you are facilitating a hypnosis session, you will also take care of extraneous variables, right? So you would want to be in a room that is quiet, has a nice lighting, has a comfortable
the
chair.
ambience has to be appropriate.
Yeah. So अगर बहुत ज़्यादा शोर है तो शायद person will not be able to concentrate. But what you're saying is yes, right? That still the effect will diminish. But of course, external environment should be such so that it can facilitate that state also, right? Does that make sense?
Yes.
Okay. So what is the use of hypnosis, or what would be the ethical use of hypnosis, is to introduce the suggestions to the unconscious mind which are relevant to patient's goal. This is so starting में somebody made a comment, right, that we use hypnosis to understand what a person is saying, and then we frame suggestions. Yeah. So this is what I meant, right? So usse pehle hi we have done a case history, we have figured out a person's goals, right? And what is relevant to their goals, we give those suggestions only, right? Also, suggestibility is not coercive. So ये भी बहुत common myth होता है कि somebody can just hypnotize somebody. So that consent and collaboration is very important. It's not true that just because I give you a suggestion, you will accept a suggestion. You should have somewhat of a willingness to accept a suggestion, right? So that is why only those suggestions are given which are relevant to the person's goal. They are given
Ma'am, I
after
have a
a certain.
question.
Mm-hmm.
Ma'am, what is hypnosis and hypnotherapy are same? Both are same?
So hypnosis is the state, right? Hypnotherapy is the use of the state.
Okay.
For
Thank you,
therapeutic purposes. Right. Yeah. So वो सारे काम पहले ही हो जाते हैं, and उसके बाद ही we give suggestions. So suggestions are very intentional. Suggestions are very goal directed. Suggestions have a very specific therapeutic value, and of course it will also help you to design a script. वरना आपको क्या पता कि किसी के लिए क्या relevant है?
So Mansi, I have one question. As we are knowing about the hypnotherapy, where we can use this hypnotherapy as a first attempt. What are those area where we directly use this hypnotherapy, which will give us a better understanding about our client?
So a good rule is to understand the boundaries of competence, right? So for example, whatever your profession is or whatever you are trained in, you when it comes to clients, you use it within that scope. For example, when doctors and physicians learn it, they often use it to facilitate anesthesia.
No, that I know, but what are those areas where we can definitely use this therapy at a first attempt?
You can use it to give simple suggestions for relaxation, for calming, for generating some sense of happiness, relaxation, some sense of confidence, some affirming statements you can use.
No, I mean to say that if we are treating an anxiety patient, that we can handle by asking the question, or we can give him or her the exposure therapy. Okay. To treat the bipolar disorder, we can go for the DBT. Okay, most of the time we use CBTs also. CBT is I think a complete therapy to understand the client and give the motivation to the client also. Like in that part, if you see a client in your daily basis practices, where you think that this hypnotherapy is the only solution for him or her to treat his or knowing the patient well. So I just want to know that area.
I think I understand your question. So
like if I have the fever, I definitely take the paracetamol first. Okay. If I have a pain, I definitely go for the painkiller. So in that way.
So hypnotherapy has same use as any other form of psychotherapy. So it can be used for, say, a clinical diagnosis. It can be used for reducing pain. It can be used to increase self-esteem, self-efficacy. It can be used to generate relax certain states of mind, also relaxation, security, roundedness. So whatever a scope of a traditional therapy is, similar is the scope of clinical hypnotherapy.
Okay.
Right?
Thank you.
Yeah. So self-hypnosis is a self-induced state of hypnosis. So we are able to. So some hypnotherapists also say that every hypnosis is self-hypnosis. So basically, a instructor or a therapist or a facilitator is just facilitating it. The person is actually hypnotizing themselves. In another practical sense, what you can say is that you yourself also can give certain suggestions to yourself, right? Maybe you can, but it is slightly more proficient. It requires certain proficiency in the technique, right? So after you have certain understanding of things, you can also maybe say record a session and listen to it on your own, something like that. So you are giving yourself those suggestions, therapeutic suggestions. That is self-hypnosis. Hypnosis in itself is also considered a self-hypnotic phenomena, that even if a facilitator is giving instruction, actual hypnosis is done by a person's mind only. Does that make sense? Any questions, comments?
Can you repeat that?
You want to repeat that? Or you want me to repeat that?
You repeat that.
What do you want me to repeat?
Like you said, therapeutic suggestions given to a self.
Yeah. So basically,
I also have a doubt. Like you said, it is a process of giving suggestions, right? Therapeutic suggestions when we are unconscious. So when we come back to conscious, there won't be any sort of conflict like regarding that suggestions, ma'am, within our conscious and unconscious?
Hope if implemented right, there shouldn't be, because those suggestions would be in alignment to your goals.
Okay.
Right?
Yeah.
So there is so before we give therapeutic suggestions, there is the entire process that is in place for you to prepare or transition into it. For example, we'll start with rapport formation, we'll start with case history, we'll set up goals, then I'll give then perhaps a very introduction session will be given, then some ego strengthening suggestions are given, right? So that you're able to accept those suggestions, then maybe we move to therapeutic suggestions. So it's a process. We do not jump right into it.
Okay, thank you, ma'am.
So, ma'am, how many sessions normally we kind of give for the hypnosis if we are giving like the hypnotherapy to someone?
Let's see. So for one goal, I'd say around 6 to 8 sessions,
Okay.
at least. Somebody might need more of something, not less definitely, but more of something. For example, somebody might need 1 or 2 sessions to get them used to this shift in consciousness. Somebody might need more ego strengthening. Somebody might need us to repeat certain suggestions a lot of times for it to actually ground. So 6 to 8 sessions for one single goal.
Ma'am,
And
is there any age bar for this therapy?
Hmm?
Is there any age limit for this therapy? Can we
No.
give it to children also?
So there is no age limit, but certain considerations are there when working with children. So, for example, with children, you'll use more stories, more imagery. You will not use very direct. So it's age
Teenagers,
appropriateness.
to the teenagers, we can give it.
Again, so there has to be certain level of appropriateness with terms of chronological and mental age also. You know that.
well, I have a question here. Like, whenever I mean, if anyone comes, whoever it is coming for the counseling, so we have several protocol in the beginning of the sessions, like we need to take MSc and, we could do the case history and everything. We prepare all that. And after that, obviously, finding out what's bothering. And then on that basis, the goal is, planned and the intervention is prepared. So now for the hypnotherapy thing is for a particular problem, as you said, that depending upon the problem, this hypnotherapy. I mean, someone else also has asked that for which problems we are actually, labeling or maybe prescribing that okay, hypnotherapy is right for this person. Now apart from that, we also have CBT and all that. So when we are giving CBT, we are not giving hypnotherapy, or we can make a mix and match, and we can give in one session CBT, or maybe or it has to be continued sessions. So how it is done?
Right. So as I said, the application of hypnotherapy is similar to any other talk therapy. Let's say we say CBT, right? So you can use CBT for a lot of things. Context changes, but we can use CBT, right? So for example, how I'll do CBT for anxiety might vary from how I do it for BPD, will vary for how I do it for dissociative disorders, for example.
Right.
But we can use it across the spectrum. Same goes for clinical hypnotherapy. So you can do it for anxiety, you can do it for BPD, you can do it for PTSD, but what will vary, right?
Yeah, I mean, that's what I'm saying. Like, if we are starting the intervention with CBT, we can bring hypnosis in for a session, or I mean, can we do that? Or if we are starting with CBT, we continue with the CBT, and then then we'll see how it works, and if it doesn't work, then we bring hypnosis in, and then see how it works. Or it works like that.
So I'm going to tell you. So do you know about EMDR?
Not much.
But you are
When
aware of the concept of EMDR, right?
yes.
So I'm understanding your question. So in practice, you can do both, right? But so how to integrate it, how to bring a flow, all of it is going to be a challenge, right? So right now in India particularly, a good integration has not been done. So for example, if you're learning hypnotherapy, they'll teach you how. For example, let's say you're treating for anxiety, so there will be a protocol how to do start from finish from a hypnotherapy perspective. There is not much information available on integration, like how to integrate, for example, CBT and hypnotherapy. It can be done. Then it kind of becomes about your experience, right? Are you with me on this?
Yes, ma'am. Yeah, got it. Yeah, understanding. Yeah.
Yeah. So there are no protocols, I'd say, or no protocols that I am aware of. So if you study it, it will be taught from a pure hypnotherapy perspective only, but integration is possible. But you will have to do a little like your experience, like, you have to bring in your experience, maybe your supervisor's experience, and how to integrate it. A lot of particularly psychotherapists do integrate it, but there are no, let's say, protocols or resources that I can refer. If in contrast you see EMDR is a very well integrated therapy. So EMDR and psychotherapy are very, very well integrated, versus clinical hypnotherapy and psychotherapy are not that well integrated, and it will require certain khud ka hi know-how in how to integrate it. Did I answer it?
Yes, ma'am. Perfect.
Okay. Any more questions?
Ma'am, can you tell the tools used in hypnotherapy? Like, is just the conversation and stuff, or they use specific tools for this kind of therapy?
So there is the entire process. We'll not get into it today. So there is hypnotic induction. So hypnotic induction is basically this transition from where you're right now to the hypnotic state. Then we deepen that trance. And when we deepen that trance, then we introduce therapeutic suggestions. Then we kind of bring it to termination, and then we do debriefing. So it's a multi-step process. And a lot of things can be done to facilitate this process. So there is breath work, there's guided imagery, there is use of metaphors and stories, and all of these things. The multi-step process, how to induce that process, there are some techniques to that.
So most of the therapies have homework. So hypnotherapy also has homework. Do we give anything for
Hypnotherapy,
to the
so it's a good
clients?
question, and this is where that integration can come. I'm not sure if you're the only person who asked about that integration question, but in starting, when we are preparing the client for hypnosis, so those initial preparatory session, we give them deep breathing exercises. We might also record a session for whatever session we have took. We can record that for them, and we can ask them to listen it before the next session, so that strengthening of suggestion is happening, right? And we can give homework. So, for example,
In most of the cases, like in most of the therapies, we've seen that just to bring the client in a just that pattern, just following a few things like meditation every day, or doing something like maybe something really productive, like something which he or she loves to do, something like that. This thing very day-to-day lifestyle, focusing on the day-to-day lifestyle where he or she gets that happiness or peace. So, I mean, is this also applicable in the hypnosis or
hypnotherapy.
hypnotherapy?
Yeah.
Hypnotherapy, sorry.
Yeah, I get your question. I'm not going to answer it directly, but you'll get an answer at the end of it. So, first is, again, we give homework in terms of preparing. We give homework in terms of like re-listening to the session, so that strengthening of a suggestion happens. Within the hypnotherapeutic script, there is an element of post-hypnosis suggestion. So whenever you're giving the suggestion, so within the script, something is embedded so that it repeats into daily life. For example, whenever next time you are in X situation, you will be more calm, right? So that's built in the script. So consciously a person is not doing homework, but there is a homework there, right? So they are implementing within the script, some suggestions are implemented so that they are able to apply them in real life. Also, you can give very direct homework also. For example, and that is where I'm saying that integration comes in that we were talking about. For example, somebody is working on feelings of confidence, for example, they're not feeling confident in their career or something. So you're giving them a suggestion, and then you're also giving them a task. Maybe, I don't know, make a list of universities or something like that, right? So that's an homework. So some elements are built into the script, some and some you can give, borrowing from other therapies. For example, you can integrate hypnotherapy and DBT skills. So you can give DBT skills for practice. Again, there are no protocols, but that's how it works in practice.
So, ma'am, today the class is on self-hypnosis. So, are we going to do anything? Any procedure? Do we? What are the procedure for the self-hypnosis? It's like obviously everything has a procedure. Self-hypnosis, like I am hypnotizing myself. So that's a self-hypnosis. So, are we going to learn anything today? Like any procedure, any step-by-step that how we are going to hypnotize ourselves?
Right. So self-hypnosis is a advanced skill in practice. Other than that, every hypnosis is self-hypnosis. One practical thing about hypnosis is, like, very practical thing to do is whenever you can record a session and you can listen back to it. So that is a self-hypnosis. And how to do a hypnosis is not a 1 hour class or a 15-minute class, but we can definitely do an induction. That's next. And maybe get some idea of what hypnosis itself look like. Does that make sense? So maybe if you have recorded that session and you're listening it to yourself, it's a self-hypnosis. But to reach to that level where, let's say, you are able to give suggestions to yourself, you are able to get into trance, then give those suggestions, then come out of it and debrief yourself, that will require certain practice, and that's definitely not a day zero skill, right? Very easy thing to do is just you record it and you listen back. That is self-hypnosis. I hope that answers your question.
So that means like the podcast nowadays can it can help us in this procedure also. The
Podcasts, how?
Podcast is just what you're listening, right? So like it's it's all about what you're listening, and then you're visualizing, and you're trying to get yourself into that situation. So I don't know, I'm just asking, this is just a question that whether podcasts can be a part of the tool of self-hypnosis or any hypnotherapy treatments.
See, clinical hypnotherapy is a very personalized process, right? And ideally, it should also not be done online. It requires an offline setup. So suggestions are personal, and there is a very close monitoring of you also that's happening, right? Podcasts can facilitate an altered state of consciousness, but it's not necessarily hypnosis. What distinguishes hypnosis from other altered state of consciousness is that it has therapeutic value, and it is customized to you.
Okay, ma'am, thanks.
Any more questions?
Yeah, Mansi.
Yeah.
What are the mild, moderate, and severe disadvantages of this hypnotherapy?
Give me a moment.
Yeah.
I like the scale. You have given me a scale. So there are certain indications and contraindications. Contraindications are that we do not do it with people who are depressed, people who are suicidal, with wherever there is split in personality, so schizophrenia, all of these we do not do. So basic idea of hypnosis is we are strengthening the ego, right? And when ego is a negative state, as it is in these things, so it's contraindicated. So you don't do it there, right? So if you reject contraindications, there are risks. So you have to be mindful of that. As such, if protocol is implemented correctly, there are no risks as such. It may be possible that you have a very strong emotional reaction, particularly if you have history of trauma and you're doing more intense level of inductions, let's say age regression, past life hypnotherapy, or even very simple things, but you have a history of trauma. So you might have strong emotional reactions that might disorient you a little, but appropriate containing procedures and protocols are in place. So you have to be very clear of why you're doing it, how you're doing it, what is the end goal, and again doing it within boundaries of competence. So anybody who is not a psychotherapist cannot use it for psychotherapeutic purposes. That's why physicians use it for anesthesia, dentists use it for anesthesia, something like that. At best, if you're a non-professional, you can use it for simple relaxation purposes, affirmation purposes. So boundaries of competence becomes more important, because essentially right now it's an adjunct therapy. We use it with something. So their boundaries so don't violate our boundaries of competence. Does that answer your question?
Okay, got it, Mansi.
Okay.
Ma'am, normally how many months or maybe it takes for anyone to learn the hypnotherapy, or to become pro in hypnotherapy or become a hypnotherapist? Better to put
There are
it
1
that
year,
way.
at least 1 year certifications are there. So there are postgraduate diplomas. There can be more, it can be more length in time. I don't know. So a lot of practice is required, and practice under supervision is required.
So
At
that
least
means, like, hypnotherapy, if we are learning, then it has to be again offline, not online, because as you say, that is more or less is mostly offline practices. Like online nowadays, a lot of counseling is happening online as well. The CBT can be done online, and all other DBT can done online. But again, hypnotherapy might not be possible. Is it so? I mean, is it true?
you can do it online, but there are again special considerations you'll have to take in place. Like for example, you have a strong internet, the person has a strong internet, right? So there shouldn't be any interruptions. You are able to observe them in a certain state. And again, there are, for example, there is certain preparation for something. For example, what will happen if, again, internet connectivity should be very strong and uninterrupted. And for example, if somebody is having an emotional reaction, how will they contain it, soothe it? All of these things, right? So it requires a better infrastructure, I'd say. Again, something EMDR has right now. I'm comparing EMDR and clinical hypnotherapy because both of them are kind of on rise, are adjunct therapies, are somatic in nature, but EMDR has kind of a more integrated infrastructure right now. Hypnotherapy also, there is this organization, I'm not sure, but they have these online protocols now. So it's also developing. So there are, again, when you're doing therapy also online, there are certain considerations you need to take place, right? So that.
Thank you.
So we have only 5 minutes left. So I'll come to this later. So I was hoping that maybe we can do a mini induction. Somebody would volunteer and we can do a mini induction, but let's come back to it later, right? So benefits for non-professionals. When I'm saying non-professionals, I'm saying people who don't have a psychology background. So it will hypnotherapy can enhance relaxation and well-being. It can improve self-esteem, and it can also increase motivation to implement lifestyle changes. So because we bypass that resistance in a hypnotherapeutic session, it makes us more likely to act on certain suggestions. For professionals, hypnotherapy is a APA recognized adjunct therapy. So there, it's recognized therapy. Right now, somatic therapies are on rise due to increase in trauma-informed interventions. So clinical hypnotherapy is integrated somatic therapy. So EMDR, hypnotherapy, all polyvagal theory. So these therapies are on rise. And future of psychotherapy does look, as of now, integration of talk therapies and somatic therapies. So hypnotherapy is a good intersection of that, I'd say. And again, it has a very wide clinical application. So all psychological disorders, all interpersonal issues, pain within pain, psychosomatic disorders. So it's a very wide clinical application. So it's very holistic, somatic, gaining momentum. So these are some benefits for professionals. Any questions? Any thoughts so far about hypnotherapy in itself?
Got an idea about what it is a little bit.
Yeah.
So
Okay. So somebody saying something? Okay. So I thought this would be a good element to introduce today. So we were talking about how hypnosis is a multi-stage process, and to facilitate those process, we might use different techniques. So guided imagery and visualization is one of those techniques, right? So we ask a person to visualize something. So yeah. So I don't know if we can do an induction or not. If organizers can tell me. It will at least take 10 minutes.
Yes, you can do.
Okay. So I'll need one volunteer, ideally whose stress level is 0 to 3 on a scale of 10. Who will do this induction with me. I'll give instructions. Anybody? It's very simple. It's very harmless also.
Yeah, I can do.
Okay.
But I have joined little late. Is that okay?
Yeah, that's okay.
Okay, just a second. Yeah, fine.
So are you ready?
Yes.
So I'm going to give a very simple, small induction. So
Okay.
there will be very simple suggestions of relaxation, maybe calmness or something. And hopefully you will feel more safe and more relaxed by the end of it. And I'll be asking you to visualize some things, and basically we'll use breath to facilitate the state. Is that okay?
Yeah.
Okay. So can I call you Shilpa by your
Yes.
first name?
Yeah.
Cool. So Shilpa,
Yes.
please take deep breaths in and out. In and out. Wonderful. Keep taking deep breaths in and out. With every deep breath in and out, in and out, you're feeling more and more relaxed in your body. With every breath in and out. Shilpa, now I want you to imagine a place where you feel safe and happy. It can be a place which is in your life right now, or a place you have visited before, or something that you'd like to visit. It can also be completely fictional, a place where you feel happy and secure. Please take deep breaths in and out, in and out, as you are in that space. Take a good look of whatever is present in that space. Notice your surroundings. As you're noticing your surroundings and taking deep breaths in and out, you're feeling more relaxed, more calm, more happy. Now, this place is your own. You can draw any boundaries around it if you wish to be alone, or you can let people in. That boundary can be created by you, or it can also be a natural boundary in form of trees or rivers or anything else that is already there. Please draw the boundaries so that you can make this place fully your own. This place where you're feeling so happy, so calm, so secure. Shilpa, this place which is fully your own, where you're feeling this calmness, security, and is your own. You can name it as per your wishing, as it is your own place. So please give it a name in your mind, your happy and your safe place where you are right now. Next time, whenever you're feeling stressed, overwhelmed, a little restless, you can think about this place, think about the name of this place, repeat that place, name of this place 3 times in your head, and you'll feel a greater sense of safety, relaxation, calmness, and confidence in your body so that you can deal with whatever is causing you stress. Shweta, Shilpa, now we will be slowly leaving this place, knowing fully that you can come back here anytime just by saying its name 3 times in your head. I will count from 10 to 1, and at the count of 1, you will be wide awake. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. As you have come back to awareness, please take as much time as you need to open your eyes.
So nice.
What's the time right now, Shilpa?
Time 8:06.
Who's the president of the country?
President Murmure.
What's 4 plus 16?
4 plus 60, 64.
Minus 5?
59.
Wonderful. How are you?
Yeah, felt awesome. But the time you started countdown, I automatically, the safe space got disappeared. It has gone dark.
So did that make you feel something?
Yeah.
How
so
did
awesome.
When it disappeared, did it make you feel something? Were you anxious or maybe panicked or something like that?
Yeah, I was quite happy in the state, smiling. So when it got disappeared, it's like something we lost.
Yeah.
Our favorite thing is gone, like from the hands. So how a like child feels like that.
I'm sorry that it was so abrupt. Usually I'd go a lot more slower. There are some limitations with context to time and also the medium.
And in that state, that made me to smile, I think. So more than I smile, actually I'm a smiling person, but that state made me to smile, like even in that, that dreams state. That's nice. Like how a child smiles even in sleep. So that was good.
So
Nice
what's the name of your place? Would you like to share? It's okay if you won't.
Yeah, it's a sky. I imagine myself on the cloud bed, and I have planted trees on the cloud bed, and I met friends to welcome friends on like each cloud bed, and we were having nice time, relaxed time with half moon, stars, satellites, all the galaxy. It was nice.
Yeah, it sounds so nice.
Yeah.
So hopefully when you think of sky again, you will be able to feel some feelings again.
Like butterflies in stomach.
Yeah.
Flying high.
So nice. So thanks for volunteering, Shilpa. Such a lovely safe space. I hope you carry it outside of the session also with you. So you can see how we use breathwork and imagery to facilitate. So would you say that aim of safety and relaxation in your body is somewhat accomplished?
Yeah. Actually, today was my rush day. So I just came home and just logged in late. But like it seemed like whole day was at peace. So no traffic, no pollution, nothing. No crowded.
Lovely. So see, my suggestions were very intentional because they were aim specific. At the same time, it was very permissive. I didn't tell her to imagine what kind of a place. I just asked her to imagine a place, right? So it's very client centered in that way. So you can see the different processes also. She was fully awake, then she was in a trance. We did that by induction. Then we deepened it a little. Actually, we didn't deepen it with Shilpa. Then I asked her to imagine it. Then I asked her to come out of it, termination, and then I debriefed it. Right? And again, I did it very quickly. It's supposed to be more slow, more nuanced, more layered. You could see that Shilpa was in trance because she was following my instructions with ease. There was certain joy and calmness and sense of relaxation that was visible in her presence also. And later she told us also. You can also see if you rush through it, what can happen. So that it felt like, because I terminated it perhaps too abruptly, you felt that, oh, something was taken away from you. You had a mild reaction to it, but again, it is important to follow a certain pace, do it with certain tension. So Tushar, this is something very mild that happened right now, right?
Okay. I have questions. Can I ask?
Yeah.
Okay. Why you ask the questions when she is in the conscious state?
To debrief her, to bring her to the present moment. So I'm asking her to use her logical
Okay.
mind.
So you want to check her that she is in the waking state, or right?
Yeah.
Okay. Do we have the various level or stages for these hypnosis? Like you guide, you give her the instructions, and she is following that instructions. At what level you give her that instructions, and what do you think that she is on that level?
So there is induction.
You got my questions?
Yeah. So there is an induction when I ask her to take deep breaths, and I asked her with each deep breath, she's becoming more relaxed and relaxed. I didn't do a lot of deepening, but I could have done a more deepening also. So maybe let's say you're walking down the stairs or something and it's more deepened, or I can keep asking her to take deep breaths. So induction and deepening kind of happens simultaneously. Once a person is there, then you introduce suggestions, right? And then there is termination and debriefing. Depth of like how deeply a person is experiencing hypnosis is dependent upon a lot of variables. So there are questionnaires to assess that and something. I know she's there because she's following my instructions. There is certain calmness. So I'm seeing she's accepting my suggestions, all of these things. Depth varies from person to person. And inductions in themselves are pretty simple, but they can be complicated to implement based on the subject, right? And again, their history also.
Okay. When you ask her regarding about the time, what is the time, she answered the question promptly. Okay. When you put the second question, that who is the president of the India, then she takes some time. So is that she is in the pre-conscious state, or what?
Not necessarily. It's also pre-conscious information, and my goal is just to get her thinking. It doesn't matter if she's right or wrong, as such.
Okay. I have one last question. So while doing this type of therapy, as we are the human beings, we generally forget the name of the person. Like you named Shweta. Okay, don't you think that makes her attention back to the awakening side, or what?
That's
or
definitely a
generally
misstep.
happen?
No. I wouldn't normalize this. It's definitely a misstep. It also indicates that why it's important to develop a rapport and have a certain relationship with the person prior, right? So I know her recently. So it's not okay to do that, but also when whatever mistake happens, it can be contained also. So both, but not be this callous about it also. It's important to take the name, right name.
Thank you.
Thank you. So I'm taking any last questions. We are above time. So thank you for being with me.
So what if the person is not answering? What if the person have slept during the hypnosis? And how do we tackle it? And how do we know that they are in hypnosis state or in sleep state?
Yeah.
So you'll know when, because your instructions are also varying, na, kind of. So you'll know if a person is sleeping or if a person is in a hypnosis, because person in hypnotic state is alert. and you will experience that alertness. It is possible, particularly clients who are very tired and stuff, that they might sleep in your induction, at least initially. That hasn't happened until now. But
And you can choose not to answer also, right?
yeah.
Okay.
So you didn't have to answer that. Also, like if I had more time, we would have established protocol for answering. So for example, I would have checked with you multiple times. So are you able to visualize the place? Are you able to see things? Are you there with me? So we would develop some kind of a signal maybe. So I would be keeping check with you. But it's okay if you don't want to answer. So if you don't want to share your personal experience, that's okay. But some sort of a communication when you are in trance might be necessary. That's very yes and no only.
Okay.
So, ma'am, just one more before you end. I just wanted to ask, like, how long does this session normally goes? By guided imagery is like some does it for 10 minutes, some does it for 15 minutes. But for the hypnosis purpose, this guided imagery, if we are doing, then it would be for how long? It is also depends on the person's condition and what kind of problem he or she is going through on that basis.
Yeah, I'd say a simple induction can be somewhere between 15 to 20 minutes.
Okay.
20, 25, 40. It does vary on the person. Also,
normally a session lasts for almost 40-45 minutes, and like in any counseling session. So like, and obviously, like if we take 10 minutes from here and 10 minutes at the end, and in between whatever the time remains, we'll try to maybe
within 45 minutes is more than enough, right? So within 45 minutes, you'll be able to do follow-up.
Yes.
You'll be able to set the objective for one session. You'll take
Right.
it, brief. So let's say 30 minutes is a good time frame.
Right.
So
okay, thank you so much.
This is the
ma'am.
most experiential part of it, right? This hypnotic trance, but you have to prepare for it. You have to terminate it. All of it is also the part. So
right.
Yeah.
It was very insightful, ma'am. Thank you very much. Learned a lot.
Ma'am, there is one more question actually. As you told while giving the induction, right, the person might sleep. So what you will be doing during that time?
So you might let them sleep for some time, or you can just tap them on their shoulder.
Probably the person is not ready for that. if he sleeps.
Yeah, maybe.
No, ma'am, like during the induction, between the induction, if the person still sleeps and if he's sleeping during that time, what would you do?
See,
you were sleeping, Anna?
one or first or second time it might be okay. That can just give you a extent of how overwhelmed this person is. That simple suggestions of relaxation are, completely leaving them to sleep. So you can tap them, let them know, you can let them sleep a little also, at least for whatever. And then you can say the coming, maybe setting an appointment time when they're more relaxed, when they have more presence, looking into lifestyle also in general, तो उस टाइम पे आइए मत अपॉइंटमेंट के लिए जो आप बहुत ज्यादा थके हुए हैं, so come in a relatively relaxed state. And of course it is resistance also, as somebody is saying, they might be resistant to your suggestions, so you will have to work on the relationship, you will have to explore the resistance, you will have to spend more time in developing a relationship.
Thank you, ma'am. The script which you say today, I know that for any guided imagery, the script has to be ready. So, so in the first induction, we give this, a particular script is given. So do we repeat the same script, or do we change the script next time as well for the second induction?
I'd say different sessions have different purposes. So it might be useful to change scripts. You will very likely change scripts.
Okay.
Also, if you're recording a session and you're asking them to listen to it as a homework, already your session is being repeated. And again, so once you start practicing, there will be some elements, some scripts you will naturally mix and match and do your own thing. So it's can be very spontaneous and flexible.
Thank you, ma'am.